Greetings, everyone. Thank you so much for joining us for the end of our day today. We really appreciate all of you being here. So grateful for the participation that you gave in the sessions that we've been going through today. Huge thank you to all of our presenters, to the staff of the CARE TA Center, including our partner organizations. I am going to share with us just a few slides to get us wrapped up today. And so I am going to, as you know, we are funded through the California Department of Healthcare Services, and we work at the Center for Applied Research Solutions. What I'm about to say does not necessarily represent anyone's opinions, but our own, but we are so grateful for the institutional support. So what we're doing here at the very end of our day is we're going to wrap up with a poetic and musical reflection. And we started the day talking about collective hope and action, and how at this very intense moment in 2022, at the crossroads of crisis and disaster response, which is made more complex by high rates of staff burnout, which is made even more complex by high rates of vacancies in behavioral health departments and increasing challenges in the community. Where do we find our hope? Where do we get the energy to not only just keep doing what we're doing, but to actually change systems? And I started off saying, one of the places that I think we can really draw a lot of hope from are the communities who have a little bit of experience getting through these types of moments. I talked about how Indigenous communities and LGBTQ communities know a thing or two about surviving a pandemic. I talked about how we can really look to BEAM, the Black Emotional and Mental Health Collective, how we can look to Mental Health America, Chinese communities, how we can look to Latinx therapy, how we can look to different examples that are coming from communities of color. We can also do the same in LGBTQ spaces to take the lead, to follow the lead of those communities. And that culturally defined practices can be just as impactful and sometimes even more impactful than evidence-based practices. Community-defined practices are things that communities have been doing for a long time. There is an evidence there. It just isn't written yet in the academic journals. But clearly, there's a reason why people keep doing these things. So I'm going to invite you to join us in a wrap-up that's different. And we're going to do it through poetry, and we're going to do it through music. Then I'm going to share with you the polling responses that you all gave us in the beginning this morning, specifically focusing on the issues of burnout and compassion fatigue. And then we're going to wrap up with our Care for Caregivers, just a couple more audience feedback questions for the very end, and say goodbye to everyone. So as a reminder, today we had 5 learning tracks. Learning track 1 was focused on children, youth, and young adult crisis care. Track 2 was mobile crisis outreach teams. Track 3, crisis care and disaster response in 2022. Track 4, justice diversion. And track 5, cultural considerations for crisis care in the community. Huge thank you to the rock star county behavioral health departments of Humboldt County, Marin County, Orange County, Riverside County, Santa Clara County, and San Mateo County. You all have participated as panelists. You shared your insight with us about your experiences rolling out Be Sensitive, Be Brave training, an evidence-based, culturally responsive approach to suicide prevention and mental health 101 in communities and counties. You talked about your work in mobile crisis teams. You talked about the work in disaster care and response and children, youth, and young adult crisis care. Our deepest appreciation for your sharing. I'm going to stop now That was one way to summarize what we did today. And that's kind of the typical way that we're used to people summarizing things, right? Now I'm going to try another way. And I ask you to be aware as I summarize these ideas about the different kinds of crises and disasters that we're experiencing in 2022 and the hope that comes from community-defined responses. Ask you to just be aware, how does it feel for you? How are your thoughts similar or different than when you hear somebody present statistics or watch a PowerPoint slide or read an article? I wrote this the other day, so bear with me. Japanese Americans and Jewish parents whisper, yelling, "Never again," arm in arm with Chicanos y Tejanos, surrounding child migrant detention facilities, hoping the babies would hear us inside the compounds, where Japanese internment camps once stood, Disney-themed caskets in Uvalde, with empty sparkle high-top sneakers and Spanish surnames that have been here long before the border was ever erected. Black and Latinx dancers twirl, laugh, and sing eternal from the other side of a Pulse nightclub massacre. Our precious queer angels soaring above us, our 2022 Pride celebrations, protecting us from homegrown terrorists, packed and loaded in an Ohio U-Haul truck. Mija, my grandma would say if she were here, taking my hand in hers. Take care of yourself and don't you take it. No, she'd say, tell it like it is. Sonar detection of indigenous children's bones in unmarked Indian school grave sites. Chinese Americans of every age defending the streets of Oakland against Asian hate. Oakland's Toisan Orange Patrol. Teams of volunteers walk to keep every elder safe. Black root workers and herbalists bringing ancestral wisdom from the African diaspora that survived the longest passage to help with recovery of today's shell-shocked souls in Buffalo. Suicide and overdose survivors returning from the razor's edge, the land of the almost dead, to help others stay alive today and tomorrow. Parents holding space and keeping hope alive for children and youth teetering daily on that edge of self-harm suicide, just wanting to make the pain stop. Growing up without coming of age milestones distanced and bullied, active shooter drills and global warming, unimaginable circumstances for youth peering into a future on a scorched earth, singed and smoking, masked and vaxxed or not. Indigenous and gay people know a thing or two about surviving pandemics. Jewish and Japanese Americans carry the genetic code of surviving generations, flourishing beyond internment. The wisdom and healing of Black people is so legendary and exceptional that even Elvis couldn't impersonate it. Mourning while moving, grieving while giving, growing while letting go. I wrote that for you. I wrote that for all of us because we're all stepping forward every day to care for our community. And so I want to ask us for a moment, how does it feel to receive this intense material? I talked about the same things I talked about this morning: suicide, overdose, racially motivated violence, the many disasters in 2022. How does it feel hearing it in a poem as opposed to reading a report or watching a PowerPoint presentation? That's the first question. The second question is, how does receiving this information in a poem impact your thought process as opposed to seeing statistics, images, or listening to a speech? And then finally, is there anything about your culture that makes the sharing of mental health related information more or less appropriate in the form of a poem? So I'm going to give us a minute to just sit with these questions and think about them. And when you're ready, if you feel so moved, I would invite you to type your responses in the chat box. And especially if you'd be open to it, turn on your microphone. It would be so powerful to hear your voices as you reflect on what it's like to receive intense information in a poem as compared to the typical way, the typical way that we receive information in a workspace. I'm going to read some of these out loud unless somebody, some brave soul wants to turn on their microphone and share it out loud. I think when we in community can hear one another's voices, especially right now, it means so much. And frankly, that's what our clients are looking for. We started this conference talking about wanting to have a conference where you felt seen, because we know that visibility matters. We wanted you to feel seen and heard as behavioral health providers who are providing frontline services in a very intense time with extreme stressors around understaffing. And you, as humans who I happen to think you're superhumans, that you keep doing this work in these times, but ultimately you are humans. And so we wanted you to know that we see you, we care. I know it sounds cheesy, but we care for you as caregivers also to the community.
There was something Nakia said in the welcome, excuse me, in the welcome session today about the importance of feeling seen. And I think the difference, you know, when you read a report or you see statistics, you don't always feel seen in these you know, professional or academic ways of sharing information, of communication. And so I think about that, and I think about sharing poetry, which in my community and my culture is an important way of connecting with each other, but also bringing light to the very real and important and intense struggles of our community. And I think about how important that is in terms of supporting folks in the community who experience behavioral health challenges and bringing that to the forefront and saying, not just looking at the clinical factors, but looking like at the culturally responsive and culturally healing ways that our communities know and have known for so long. And so just thank you for sharing that. I see others want to join and speak as well.
Thank you, Ayana. Carrie, would you like to share?
Yeah, so for me, you know, I don't know why, but I feel very desensitized to a lot of things, you know, that I read, or, you know, data and this thing and that thing. And I actually kind of got teary-eyed when you were reading that. And, you know, it just kind of like brought it all. It made it more personal, made it more relatable. And, you know, I felt more connected. And, you know, I always say it's really important to look somebody in the eye when you're talking to them. And you know, that's why, you know, because we see all of this stuff on TV, we read about all this stuff, and, you know, and especially in this line of work, we hear a lot of data, and it just becomes unemotional, because that's part of, or at least for me, sometimes it feels that way. And that's because I have to, you know, break everything down, and, you know, I have control over this, don't have control over that. So I'm not, you know, but it all affects us. and whether we realize it or not. So thank you so much, Eliana, for sharing that. It really touched my soul today. So thank you. And this has been a great conference. It's not the first aha moment I've had today. So thank you.
Ah, that means so much. And I just want to take that thank you and say, Ruth Santos, wherever you are, our conference queen, Ayana McGee, Angela Brand, these women were up really late, a lot of nights putting this together. So I hope that everything that people say in the chat and put out there. See now, Ayana, I'm going to start crying. Okay, Stacey, I see that your hand is up. Did you want to share something?
I do want to share. I think I know for a fact that we could hear you, not only just see you, but we could hear you. We have papers passed by our desks in our emails and all day long, but I could visualize your grandmother talking to you, because she was here and she would want more for us. And unfortunately, we're at a time like this, time that we would hope we would never have to go back to. But we haven't overcome what they have overcome. So I am grateful for you to be able to take the day so we could hear it. So I applaud you. Because you just encapsulated the whole day in what you said. So if anybody missed any, if you were in one session and needed to be in another, she gave it all to you right now. That is our marching orders. So thank you.
Stacey, thank you so much for saying that. And my grandma Helen, I miss her something very fierce. And I felt her through you in that moment. So thank you. And I know that many of us have experienced a lot of grief and loss, in the last couple of years, especially. In fact, I'm going to pull up the slides here, and I am aware of time. So my amazing colleagues, if they're holding space and wondering if I'm aware, I am this time aware of time. Okay, so I'm going to share with you a song because it's to hold space for our grief. Because when I asked you at the beginning of the conference, if you have been personally impacted by any of the following, 92% of the people here this morning said that they have been impacted by COVID-19. Several people in my family have passed. Several people in my family have been sick. But we don't need people to pass to have a grieving process right now, right? Complex, ambiguous loss, a lot of us are feeling that. And in our work, before the pandemic even started, a lot of us have lost people personally and through our work. So I want to share this with you. This is Bear Fox singing Sky World Song. Let me make sure that I've done this properly so you can hear her because she is so amazing. And I will put the link in the chat for you. This is dedicated to all of you.
Okay, now we're gonna do the Skyward song. And this song is to help with the ones that are grieving. And I'm hoping that it will help bring peace to your minds. We'll be thinking of our loved ones that are in the sky world and that they're at peace. Skanikola de wadon dano iti yalak nelona do hitstum de tinum balados ne aquego skana kaha Negalum yagelonum yo hayo ya anayo hayo ya skana agaha Negalum yagelonum hayo ya hana yo we a hey yo hi yo we a hana yo we a hey hi yo we a hana yo we a yo we a we hana yo we a hey. Let's put our minds together as one and remember those who have passed on to the sky world. Their life duties are complete. They are living peacefully in the sky world. In the sky world, they will never be forgotten. No more pain, no more suffering in the sky world. In the sky world, Ayo-ho-we-ya, Hana-yo-ho-we-ya, hey-yo, hi-yo, hi-yo-ho-we-ya, Hana-yo-ho-we-ya, hey. Hi-yo, hi-yo-ho-we-ya, Hana-yo, hi-yo-ho-we-ya, yo-ho-we-ya. We hana yo we are. Their life duties are complete. They are living peacefully in the sky world. In the sky world.
Earlier on in the day, we shared an incredible concept paper that the California Pan-Ethnic Health Network published recently about community-defined evidence practices. And we know, because we've been doing focus groups through another project with county behavioral health departments, there's a lot of interest in learning about the kinds of practices that diverse communities have been using since the beginning of their communities to help heal the hurt that people are also walking with. And so my hope was that this would be a little bit of an experiential end of conference to give you a sense of what it's like to receive information in a different way, to let us know that it's okay, we can be bold, we can be brave, and we can take a little bit of action to imagine something new right now, because we are all hurting so much and suffering so much, as are the people that we work with. And it is a very reasonable thing to partition off how we feel at work. We have to, right? Because we are so present to what other people are experiencing. And that's also, it can be a part of compassion fatigue and burnout. And in fact, when we asked, so I'm just going to move through this, this was kind of interesting. 48% of the people who answered this poll said that they are county behavioral health staff. And when we asked like what kind of role, the 40%, the greatest percentage, identify as mental health clinicians, counselors, or therapists, followed by program administrators. Okay. But then when we got to that question about burnout, there were high rates of burnout, and apologies because I did this kind of quickly in between sessions here, but here's the question about burnout. When we asked, to what extent do you feel burnout? 51% said somewhat burnt out. 27% said very burnt out. And only 21% of us said not at all burnt out. I said us, I didn't vote. I would have said very burnt out, to be honest with you. I do want to acknowledge that we didn't define what burnout means. We were kind of moving through this quickly. So if we took a moment to operationalize that and talk to one another, what does that actually mean? These numbers might shift a little bit. But I think importantly, when we think about systems change, and our crisis continuum of care system and our disaster response system are only as healthful and strong as we are, it's a really important question to ask. Does your employer help prevent or manage burnout with any of the following approaches or resources. And I just want to put a shout out for all the supervisors and executive directors and everyone else who's out there. Many of us are kind of building this plane as we're flying it, right? Nobody ever trained us in how to lead groups of people through everything that's going on right now. But interestingly enough, when we asked what were some of the approaches or resources that might be used by your employer, and then we said we were going to share this back with you because this might be really useful information to take back to your work site, to say, oh, this is what we learned, all of us who are at this conference, and thinking about how we can care for ourselves at work so that we can continue to do this really important work. 60% of us said that they are offered an employee assistance program. And we know it matters if we have diverse staff available to reach out to. If I had an employee assistance program, could I find an LGBTQ provider? A lot of the grief and stress that I'm holding right now is as an LGBTQ person who's scared because of recent statements that have been made by the Supreme Court. It's scary right now. I need to talk to somebody who knows that. But I don't have to explain that to you, right? Another 47% after that, or 54% after that, are regular check-ins with a compassionate supervisor. Now, I didn't also ask you regular check-ins with a non-compassionate supervisor, so we don't really know which part of that you were really affirming, but theoretically, and we will share this with you. But following this with offering flexible work schedules. So this is one of the beauties of this moment that we're in, the breaking open, right, of this moment. We have an opportunity to create something new. And it seems like a number of employers are thinking about new things like flexible work schedules. And we were kind of forced to also thinking about remote work. But how can we take this moment of change? It might feel like chaos at times, and take the space to imagine something new. So on that final point, I just want to please go to the Care TA Center website. We would love to use the money that is funded by the Mental Health Services Act to provide you no cost TA. We have a variety of resources that are set up to support systemic change, the crisis continuum of care and justice diversion across the state, including connecting you with other counties who are at the same stage of implementation as your county is. And you can take 2 minutes. It really only takes about 2 minutes to complete a TA request. And with that, I'm going to invite our staff to please pull up our end of session polling. And I promise I will not bug you with another Zoom polling request today. This is it, folks. We're mailing you a care package. Continuing with our theme, yes, but we're mailing you a package that has hand sanitizer and a mask. It's not a hospital grade mask, but it's a mask. It's a cloth mask, water bottle, a little notebook where you can take your clinical notes or whatever notes for your own wellness and support of yourself as employees. Oh, Carrie still has hers from last year. Okay, Carrie, thank you. It's just us acknowledging how much you're doing out there. And oftentimes the workforce, we're doing everything and it's like we're not even seen. And we're dealing with folks when they're having the hardest time, right? Typically people don't go to Access Behavioral Services when they're feeling really great and happy about everything else in the world. So thank you. And it's just a very small way for us to say that we see you and thank you. Last and not least, we're going to send you a follow-up email because we want to give you your no-cost CEUs for attending this conference. It's really important that you please complete our Survey Monkey. That is the final step in getting the CEUs sent to you. Thank you so much for all of your time, for being here, for everything that you do. We look forward to being in community with you. Take good care, everyone.